Dr. Michael Farbaniec, Medical Director of Cardiac Disease Prevention at Penn State Health, and also Joyce Wert. And Joyce, today's show is possible because of a generous gift that you made to Penn State Health Heart and Vascular Institute, and this is in memory of your son. So talk to me about why you do this, why heart health and heart disease prevention is so important.
Yes, thank you. 8.5 years ago, my son Kevin was at the fitness center exercising, which is part of his routine. He was walking from the treadmill to an exercise bike and bent over, and most people thought he was bending over to tie his shoes, when in fact he went into cardiac arrest. The autopsy confirmed that he had cardiovascular disease. And for me, the loss of Kevin at the age of 46 is the most traumatic thing that I have ever experienced. As a mother, no mother should lose their child. And so my hope and prayer through this program is that we can save at least one life and help others to see the importance of taking care of their health. So that's why this is so important to me.
Oh my gosh, thank you for sharing your story. Speaking of important, how important is somebody like Joyce to you? What kind of impact does Joyce's generous gift have?
It means everything. And thank you so much, Joyce, for everything that you've done through gifts like this and through people that are so supportive of what we're doing here. We have access to our patients, and our patients have better access to us. So having that access is so imperative to us to manage these risk factors, see symptoms early. That way we can prevent heart attacks.
Joyce, you mentioned if you can save just one life today with this show, it is worth it. I bet your impact will spread beyond just one life. What sort of feedback have you received from the community as you go through these efforts?
Some of my friends and even family members have expressed to me that they are very appreciative that we have begun to look at other ways other ways to help people going forward, people to be able to look beyond how they might be feeling at the present time, but talking to their doctors about making sure that they are testing if there might be possible heart issues. And so it's with that and with the research that's being done at Hershey that we believe that we can prevent possible death. So.
Well, you just mentioned a key point, like talking with your doctors, being there. And doctor, you had mentioned, go for checkups, get those physicals, pay attention to your overall health. What really is your message to viewers today?
So if I had to give a take-home message to all of our viewers today, it would be, don't wait on starting a heart-healthy lifestyle. Think about your heart health today. And follow with your primary care physician, follow with them regularly, know your numbers, know your blood pressure, manage it, know your blood glucose, manage it, know your blood cholesterol levels and manage them. And also move every day. Whatever way you like to move, you move. Move your body, exercise. I cannot stress the importance of this, not just for the health of your body, but also the health of your mind.
And Joyce, you are such an advocate for heart health and heart disease prevention, knowing signs and symptoms. What do you want to say to our viewers?
I guess my message to viewers is I can't go back in time and do anything different with my son Kevin than what I did as a mother who loved her son so much. But I do hope that parents, maybe at an earlier age with their children, will see the need to take them to the doctors. And I understand today that there are tests available for children, for young adults to be tested for those that might be a potential person who could have heart issues. I didn't know, I wasn't aware of that when Kevin was a youngster.
Sure.
Certainly when he was 46 years old, I could suggest he go to the doctor, but I couldn't tell him he had to.
Yeah.
That was beyond that point. But my point would be, I guess, if you're having any doubt, any thoughts that there could be a possible heart issue, and in some cases, you might not have any signs. Don't delay going to see your doctors, routine doctor visits. Being very active, I think, is also important, and trying to eat right. And so if there's somebody out there trying to maybe change a little bit to make sure that you're going to be healthy or be as healthy as possible, make those changes, see your doctor, and be tested.
And as the doctor here said, do it right now. Thank you so much,
Absolutely.
Dr. and Joyce, both for your time and
Thank you.
information
Thank you.
today.